Hey guys, this is Queer Boy. I'm doing a little mini video vlog regarding about the most recent surgery that I did. Gotten my tonsils out. Late last year, I went and see a specialist regarding about this cough. This cough turned into a discovery of my tonsils were inflamed and large, and this doctor recommended that I should get them out. So for a couple of weeks, a month so, I thought about it and I said, sure, why not? It's gonna be better for my health. It's better for sleeping, breathing, living, I guess. She also asked if I had a severe sleep apnea, which I do, and then she moved from recommend to you should do this for your health wise. So prior to getting the surgery, I've done not a lot of research, but I googled, I watched videos, and it kind of scared me at the beginning, but overall overcome it. Kids had done it, and as a 40 something years old man, I should do it. Don't be a wuss, my thing. So I done it. This is my 14th day. I'm still trying to get the hang of the whole talking thing. Sometimes my voice tends to crack because my throat or my mouth is still recovering. But overall, not bad.
Good morning. We are on our way to my appointment with my deceased dad. It's raining. It's nice here. That was quick. We're here at the bottom floor. Oh wow, the door just opened by itself. Automatic, well, futuristic. Oh. We have to put it in a plastic. Oy. Ta-da! And then she said to the right. I think she said to the right. And at the hall. To take up B1 and B2.
I know, put your stuff in your bag, in your pocket, your jacket pocket.
Mm-hmm.
So, on the day of the surgery, my older sister, took a day off to help me check in, get situated, and help me out. Kudos to my sister on this one. She really did pull through, so kind of grateful for that. So on that day, we parked the car, we checked in, we did all that. I wasn't able to record any videos because one, not a lot of people around there want to be in the video. Two, I respect people's privacy. I don't want to be putting anyone in that situation where they see a video and then all of a sudden they're like, who the or why was I recording and all that. So there's a couple of video clips where getting from the parking space or parking lot to the check-in, the admin, and then checking in. So that was kind of like my check-in. So after the surgery, waking up kind of groggy and kind of weird, this nurse was sitting next to me and asked if I'm okay. I couldn't talk, of course, because like your mouth is still, sore, numb, or all that, or medicated. So then he insisted if I wanted something to drink, and I said yes. And then he says, "Here's some ice water." Really did help about that. That little, even though that I was kind of still in and out of, waking up, going back to sleep, waking up, and all that. That cold water really did help with the whole mouth situation. It felt weird, but yeah. And then they had to wait a while to make sure that nothing is going on. They waited about so there's two recovery area where you come out from your surgery and you go to this area where they wait until you wake up and then see if you're doing well, if you listen through on their question, if you answer right. I don't know if you don't, then I don't know what happens. But when I was there, they asked me a couple questions, where I was, and what was I doing, what did I did, or what had I done, why am I there? So all that question. And then after that, when I was fully awake, then they wheeled me to another recovery area where another nurse talked to you about, you're getting released, this is what you need to do, the medication, what you need to be doing once you get out from this place, all that. Before they talk to you about all that, they want to make sure that you're wide awake or conscious. Like you know what you're talking about, or they know that you know what you're talking about. So they do that. They start to, the lady started to wheel me out, and she's talking to me. She's asking me if I am ready to go home, if I'm in any pain, don't forget to take my medication, and all that. So as soon as my sister saw me, she said, okay, I mean, I thought I was capable of walking, but I guess I wasn't. But thankfully, both of them were helping me to shove me into that front seat, or else I would just be knocking myself or hitting myself onto the overhead thing, the car. But yeah, so on our way to the house. So at this point, we got into my room. My sister is, getting my medication situated, getting, like reading through what the paperwork is, what I need to take on the clock. And she had told me to set up an alarm. So my alarm system was actually pretty intense. This is how it goes. So this is my alarm system. So I had it starting from 9 p.m. and then 1 o'clock, 5 o'clock, 9 a.m., 1 p.m., 5 p.m., and then it goes full circle. Because I need to be medicated. Because I need to be medicated on the clock, 3 to 4 hours time, or else you'll feel the pain. This is mostly for to make sure that you don't feel the pain, because according to them, the doctor and anyone else, the pain is unbearable. Yes, it was. You'll see me a couple of times where I had to wake up and where I had to it's hard swallowing. So then from the first day to the 7th day, it was really painful. swallowing part is really hard after getting this surgery. No matter how many times they say, drink a lot of fluid, drink a lot of water. It's easy to say, but it's hard to do. When you're in that situation where you don't want to feel that pain, and a little thing by swallowing things makes that pain start, it's hard, so hard. And the most painful part on this journey is that I think it was in the third day, I've started to have ear pain. So when I had asked the doctor what should I expect about, recovery, and she said, you'll have this pain sensation in your both ears, because it's connected to your throat, some nerve or something like that connected to your throat, your ear. So you'll have the sensation of feeling that your ears are infected or ringing nonstop. So on the third day, I started to feel the ringing and the numbing, not numbing, but the pain of like intense pain as I swallow anything from my saliva, water, my medication. Every time was so painful. So when the doctor, good thing the doctor told me about this, because if I wasn't, I would have been calling the doctor's office and see if this is going to be a regular thing, but good thing she told me. Yeah, that was a tough time. The good thing about coming out of that was that the ear feeling or sensation and ringing goes away. But today, 14th day, I had this ringing in my ear, and for some reason when I swallowed, I had that little intense pain on my ear. So I guess it doesn't go away until later. But here I thought, I'm okay, but it comes back. The one thing about this that I, thought about is that I needed to vomit, or I needed to gargle and throw up. So what the doctor said, that if you vomit, throw up, or drool, it's fine. And if you vomit or throw up and there's a little blood clot along with your spit, that's fine. That's normal, because that means your scab is healing, your surgery is healing, so that's fine. Now, the number one concern that the doctor says, that if you start to feel warm sensation or a flow of warm sensation in your throat, or you're starting to cough up blood and it's liquid, it's not like those blood clots or chunks, then you need to go to the emergency room and they can close up whatever open wound that's causing that blood to flow. Good thing I didn't have that. So then I set up a little bucket next to my bed, so then whenever I feel like throwing up, it's there. It's this weird sensation that you have something at the back of your throat, which is, there is. All your saliva, all that blood are all trapped in there. So you feel like you need to grab some water and swishing back and forth and then throw up. It actually really did help. So there's a couple of medication on there, the lidocaine mouth thing. I got a prescription for it, but I didn't try it because I was trying to be macho man, where I thought, I don't need it. I should have. There's a couple times in that 7-day time span where I needed that my mouth to be numb, but I didn't. Because one thing is that with all these pain, the first thing that you want to do is to not take any more medication, or is to not swallow any more things, not to swallow liquid, anything like that. But also with that gargling thing, it's hard because it's putting all that liquid in the back of your throat. Another thing for recovery, if you don't have one before getting your surgery done or before your recovery date, get a cool mist humidifier. It will save your life, because when you sleep, after the surgery, your mouth is open. So when your mouth is open, air gets in there, and you need moisture. Moisture will put your mouth a little bit more moist instead of dry. Now, having it, I think 2 days, 3 days that I didn't have my humidifier was painful. For day 1 to I think day 5, I had no humidifier. I asked my mom, and she bought me one, and she said you might need it. So then I bought them, and that really did help, because from the day 1 to day 5, my mouth was open, my mouth was dry, and you know how it goes when you have an open wound, it starts to scab. So when you have that, it's so hard to swallow. Okay, so prepping wise, like I said, I googled, I YouTubed all these people who had done tonsillectomy surgery, I think that's what it's called, and majority of them had said no solid food, liquid diet is the most go-to. So then 3 days, I went to the store and bought a couple things. I bought a couple broth, chicken broth, beef broth, vegetable broth, and then I bought 2 bags of popsicles, and then what else did I buy? And I think ice cream. So that was my initial, prep. And then along those days, my friends, my family started to buy me stuff also. My family decided to get me distilled water, more broth, to make jellos, applesauce, and more water. It was actually really, really helpful. Thank you. And that is just my prep, getting myself situated before going to the surgery. The best recommendation that I got from all this, or the best thing that I researched about this, is that cold food, meaning like ice cream, popsicle, ice water, if you want tea, iced tea, make sure you don't have ice in your mouth, because if it goes in there, it's gonna hurt. So I did that. So yeah, that's it. Thank you for listening to me rambling, talking nonsense, telling you about my experience, and hopefully some of you guys who's watching this or Googling or researching how painful it is, and you've seen these other YouTubers or YouTube channels that I feel like they're really putting out a brave face by having, oh my god, it's not as bad, or they're smiling. I wasn't smiling. As you can see in the video, I was in pain. no shade to them, no shade to them. But I guess this is in everyone's basic experience, or this is base of their experience. My base experience wasn't so happy and giddy, but yeah, I mean, just power through. If you have any questions, call your doctor and try your best to drink liquid. I know it's really hard for me to say that because I myself not really drinking a lot of water at that time when I was healing, but I try my best. But yeah, make sure that your throat is moist, it's not dry. So then swallowing something, swallowing your medication, swallowing water, swallowing anything, your broth or whatnot, that it's easy. Would I recommend this for medical or health issue wise? Yes, I recommend, if you have really severe sleep apnea, try it. Currently, I haven't had my test yet for my sleep apnea since I'm still healing, but if this will help out your breathing for you to live a little longer, might as well. And also double check on your doctor, see if it's recommended, or would they say this is better for you for your health. Try that. Don't listen to me. This is just based of all my experience. But yeah, hopefully this helps, and maybe after this video this should be a little lighter, happy, giddy videos, but currently this is what I have. So thank you for watching. Later.